Make sure you have completed the interactive activities, which is the Padlet questions, and also the polling. Okay, if you have not done so, please go ahead and do it now. Stop this video, right? So once you have done that, then you come back to this video. Okay, so now that you are done, now let me do a closure of these interactive activities you have earlier on. So for Dr. A, he worked in a restructured hospital, recommended colonoscopy after series of tests as it could result in better clinical outcome despite the risk of performing the CT scan, and the risk is radiation for my aunt. Unnecessary tests and procedures, there is always an extra cost involved, and so the bill turns out to be $1,500 even before the colonoscopy procedure. And this is an example of positive defensive medicine, of Dr. A doing more so that he could justify himself to why if any complication occur, and also potential litigation. As for Dr. B, he recommended very conservative advice as he opined that colonoscopy would carry a very high risk for my 70-year-old aunt. He avoids the procedure of my aunt, and he's practicing negative defensive medicine. So he framed the advice such that it is of high risk to my aunt, and in other words saying no to my aunt. Now, as for Dr. C, the panel doctor under my aunt's insurance company ordered colonoscopy procedure as per the hospital guideline. To him, it is a cost-effective measure to find out the root cause of my aunt's issue, and the entire cost will be paid by the insurance company. So here is a case that Dr. C may have done the very right thing, and it is also for the benefits of my aunt, whether it is in terms of helping her to get better or is in terms of the financial side of things. So obviously my aunt opted Dr. C for fear of excessive bill size, and also someone that is recommended